Welcome to Tocilizumab Chronicles Beyond the Cytokine Storm, where we explore the intricacies of tocilizumab and its role in medicine. I'm your host, Dr. Shikha Agrawal, and in today's episode of Tocilizumab in Pediatrics, in context of challenges and opportunities, joining me as always is Prachi Virat, a microbiology and bioinformatics enthusiast. Prachi, great to have you back.
Thank you, Dr. Shikha. I am really excited about today's discussion. Pediatric therapeutics is such an vital area of research and clinical practices, and tocilizumab's role is quite fascinating here.
Let's dive right in. What are some unique challenges in treating pediatric patients with tocilizumab?
Great question. One of the biggest challenges is the limited availability of robust clinical trial data in children, especially for off label indications. Pediatric patients also have developed immune systems and different pharmacokinetic profile compared to adults, which can impact both the safety and efficacy of drug. Additionally, recognizing adverse effect or atypical infection can be more complicated in younger children. There's also the need of age appropriate formulation and careful monitoring for growth and development issues during long term immunosuppressive therapies.
That's a clear overview of the complexities involved. On the flip side, what are some of the benefits and opportunities of using tocilizumab in pediatric patients?
Good follow up, Dr. Shikha. Despite the challenges, tocilizumab has shown excellent efficacy in treating conditions like somatic, juvenile idiopathic arthritis, sJIA, and cytokine release syndrome (CRS) in children, particularly those receiving CAR T therapy. The opportunity lies in its rapid action in controlling hyperinflammation, improving quality of life, and reducing corticosteroid dependency, which is particularly beneficial for pediatric patients since, given the long term side effects of steroids on growth and bone health.
Excellent points. Thanks for outlining those benefits. How does the dosing and administration of tocilizumab differ in pediatric patients compared to adults?
Another important question: dosing in pediatrics is typically weight based. For example, in sJIA, children weighing less than 30 kg receives 12 mg per kg every 2 weeks, while those over 30 kg get 8 mg per kg. The frequency can vary based on disease severity and clinical response. The drug is administered by intravenous infusion in most cases, though subcutaneous options are being explored. It's crucial to adjust dosing schedule and monitoring pharmacokinetic because clearance rate differs significantly in younger patients.
Really helpful detail, Prachi. Thank you for breaking that down. What are some key considerations clinicians should keep in mind when treating pediatric patients with tocilizumab?
Good question again, Dr. Shika. Clinicians need to screen for latent infection, especially TB, prior to treatment and ensure immunization are up to date. Regular monitoring of liver enzymes, neutrophil counts, lipid profile, and growth parameters is essential. Special attention should be paid to the risk of gastrointestinal perforation, rare but serious. Also, involving the family's treatment decision and educating caregivers because early infection sign is crucial for safe home monitoring.
Brilliantly explained as always. Before we wrap up, Prachi, what would you say are the key takeaways for our listeners today?
I would say tocilizumab offer valuable therapeutic options for severe pediatric inflammatory disease, especially where conventional treatment falls short. However, it depends carefully patient selection, vigilant monitoring, and ongoing research to optimize safety and efficacy for younger populations.
Perfectly summed up. Thank you, Prachi. And to our listeners, thank you for joining us again today. If you found value in this episode, please hit subscribe and share it with your colleagues and friends. Until next time, stay